I'm super excited to be part of TIPS, and thank you so much for inviting me to join this panel. Yes, I will in the next couple of minutes. Sorry, I just need to have it to change slide. I'll do like this. For the next 10 minutes, I will be speaking about, I'll give you a very, very brief introduction to Center for Telepsychiatry and the work that we do in Denmark. Then, of course, I will speak about our work, how we build trust in digital mental health, and I will close my brief talk here speaking about well, the three largest challenges for building technology in mental health care, and why trust is so crucial for the implementation of digital tech. So, Center for Telepsychiatry, where I work, is a part of a psychiatric hospital in the region of southern Denmark. On top, you see the image of little Denmark, and marked in gray is the region that our psychiatric hospital serves. So we launched 8 years ago as a resource center for the psychiatric hospital to advance ideas for improving mental health care using digital technologies. So we work with collaboratively, we work with service users, with patients, with clinicians, with the researchers and health tech partners to identify, to build and to evaluate digital mental health tech to support mental health and well-being. And our long-term goal is to contribute to a mental health service where in-person and online integrate to expand access to mental health care and to improve outcomes for mental health. So a few examples of what we do at Center for Telepsychiatry. We provide internet-based cognitive behavior therapy for depression, anxiety, alcohol use disorder, and binge eating disorder with national patient uptake for adults. We pilot a national app assessment service guiding patients and clinicians in selecting safe apps, safe and evidence-based mental health apps, and we provide implementation support and digital skills training in all of our mental health departments across inpatient and outpatient settings. So as an organization, we are regionally based, but we operate nationally, serving people with mental health problems throughout the country. Also, do keep in mind that in Denmark, mental health care is public with free and equal access to services for all citizens. So I feel like beginning with a bit of a disclaimer, because when discussing trust and mistrust, our point of departure in Scandinavia is different from the situation in the US. So Denmark is a very small, very homogeneous country with a high level of social trust that you, Michelle, already mentioned. And this is just perfectly exemplified here by this picture in Denmark. Parents often leave their sleeping babies outside of cafes, even on a busy street. Here we are in Copenhagen. And this practice would be, I guess, unthinkable in most parts of the world. The photo also shows another example of trust in Denmark. Denmark right now is back to our daily lives almost, often forgetting even that the COVID-19 pandemic still rages in much of the world. Why? Again, trust here is a key factor. The general public in large, generally, they trust the authorities, they trust healthcare, the healthcare sector, the politicians, and each other. So this trust, this high level of trust in the population, it encouraged high vaccination rates and the successful implementation of key COVID-19 policies, such as mass testing of the population and also this coronavirus passport. However, it's clear that mistrust in digital technologies is growing in much of the world, also in Denmark. This picture shows Facebook founder Mark Zuckerberg joining yet another congressional hearing regarding the platform's mishandling of its users' privacy, undermining trust in him and his social media platform. So in Denmark, we have similar experiences, even several cases of public sector organizations leaking citizen-sensitive personal health information. And this seriously undermines Danish citizens' trust in public digital health services. So how do we build and maintain trust in digital mental health? At Center for Telepsychiatry, considerations about ethics, digital inclusion, personal privacy, and data security are part of our digital innovation projects from the start. So this image here is from one of our research projects where we test the feasibility of using virtual reality for exposure therapy with people suffering from social anxiety, combined with different forms of biosensor technology to monitor anxiety levels. And this, the idea in this project is to develop and to evaluate and implement a VR setup where the patient can train exposure therapy at home on their own. So this is explorative scientific research. We only scale up our digital services when we are confident in the patient safety and the evidence base. And these two factors are extremely important in building trust. So people know that we only offer tried and tested treatment services in routine care. So a well-planned user journey is key to a great digital mental health service. That's our experience. However, I believe that the user experience holds a dilemma we must balance very, very delicately, because I guess we've learned from design thinking and Silicon Valley, from you guys, that digital services must be frictionless and very, very easy to navigate. However, not all things are that simple. So receiving digital therapy for a psychiatric diagnosis is different from streaming a movie or a Netflix series. So we often have to design a very careful patient journey across in-person consultations as well as several different digital platforms. So adopting digital mental health is not simply downloading the app. Often we have to rethink entirely our daily work routines as clinicians and our organizations from bottom up. This is an image of the login screen to the national Danish two-factor ID system, supported by public authorities and guarding most digital public services concerning health and social care in Denmark. So safeguarding access to patient data and having strict measures for handling data. These measures are essential in building trust in digital public services. So in digital mental health, this is pivotal given the widespread perceived stigma and of course also the need for confidentiality among service users. Also, as some of you already have talked about, personal relations build trust over time. So in Denmark, we have a very long tradition with calling our GPs our family doctor. So all persons, a person know their family doctor and they trust him or her. So through several years of digitizing public healthcare, we are used to communicate with our GP using also different types of digital tools. Right now we're using an app called Min Sundhed, My Health. It translates to this. So through this app, citizens have access to their personal health records. They can communicate with their GP, handle prescriptions and appointments. So my final point about trust is that adequate digital skills build trust. So an extremely important learning point, from the COVID-19 pandemic is that the digital skills of clinicians and the availability of technical support to clinicians and patients are key factors in determining patients' experience with digital mental health services and their propensity for trusting and engaging with the digital service. So we need to combine human touch with digital tech in innovative new ways. So patient trust in adopting and using digital technologies depends on provider trust, which in turn depends on institutional trust in digital mental health. These three levels are deeply interrelated, and they necessitate a thorough framework for developing, evaluating, and implementing and scaling digital mental health. So in conclusion, I see three main factors as essential in building and maintaining trust. Number one, high standards of treatment quality in person and online with evidence-based treatment and co-production of services, safeguarding patient privacy, and finally, what I've called, well, human relations, technical support and digital skills. So to me, an overall conclusion is that for many years, we've talked about apps and other digital solutions as these quick fixes to our problems. They are not quick fixes and definitely not in mental health care. So there are immense potentials to realize with digital mental health, but we have a lot of hard work to do, and working very seriously with these three challenges, I think, is a great starting point.
Awesome. Thank you, Marie. I'm always just so impressed with the work going on in Denmark. And, you know, in some of our conversations, just so impressed with the level of social trust. But we've talked about that being both a pro and a con, which at first I was like, that's just so amazing. And you're like, well, hold on, think about it a little more objectively. Can you talk a bit about that? And actually, do you mind taking down your slide too?
Yes, of course. Yeah. Sorry.
No worries.
Great. Well, yes, of course, there are several cons of having a high trusting population. So high trust, I think, also combined with high ICT literacy in the Danish population. They have kind of driven this public sector race with the digitalization. So one example is that our internet-based therapy service, we received permanent funding during in the start of the COVID-19 pandemic. So we have this climate of trust and government support, and also, of course, a very mature, available ICT infrastructure in Denmark. And this is just a great starting point. But of course, the risk is that this digitalization of public services, that it will reinforce digital and social exclusion of people already at risk of being left behind. So I think having such a high trust level puts a great responsibility on our shoulders as digital mental health providers, that we have to stop, to pause and reflect about the consequences of this rapid rapid innovation race, and that we very, very critically examine whether our services are they accessible? How accessible are they? And are they accessible to all users? And start looking into this. Yeah, also digital skill levels of patients and clinicians.
I think that's such an important point, and really translates to the US too, right? With some of these innovations, I love what you said before, was they're not a quick fix. And in fact, we have to be so thoughtful about the way we implement mental health technology and design mental health technology, because, you know, we can perpetuate a lot of inequities and inclusion issues. And right, we are talking about a vulnerable population, mental health, people with mental health issues. How do you take that into account and think about, like, you have high levels of social trust in Denmark, but then, right, this vulnerable population, how do you really, with like people with mental health issues, how do you really not take advantage of that, right? So implementing all sorts of technologies, awesome, we have this quick fix, whatever. How do you really kind of pull all of those pieces together? Because we are responsible, right? You are that's a heavy weight, right? Yeah.
I guess we're only at the start of this journey, so we are really acknowledging, increasingly acknowledging that this part about digital skills, so the clinician's ability to assess the technology readiness level of the patient, that's one step. And then of course also providing the necessary support infrastructure. That has actually been quite of a challenge in our hospital. So convincing the upper level management that we have to have a training program for training clinicians as well as patients. We cannot just say, well, we have the technologies, use them, because of course, you know, you trust them. You have to provide the kind of supporting infrastructure for enabling this digital psychiatry revolution. It's not, trust is not everything. And in Denmark, even though we have high levels of trust, implementation is still slow. Implementation into routine care is slow. So it's not just trust that we have to tackle.
Yes, and there, you know, it's kind of echoed across all the presentations, the human component. Yeah. We love technology because it responds quickly sometimes, most of the time. And, you know, we get this response back and, you know, could download something, we want a quick fix. But in the end, there is a significant human component. We're talking about mental health issues, psychiatric care. And because of that, we cannot forget about the role really of trust, right? And that we're dealing with people. So cool.
Definitely.
Thank you, Marie.